That's great. Thank you, Fiona. And it's great to have this opportunity to talk about the psychological impact of COVID-19 on nurses and midwives. This is the second survey that I'm reporting on. We carried out a survey in 2020, which was reported in the World of Irish Nursing in November 2020. I suppose to start off, in terms of the surveys carried out due to the impact of COVID-19, because we knew that it was adding enormous stress upon healthcare workers and society generally, individuals in society, but particularly those in the caring profession and those caring for people with COVID-19, primarily nurses and midwives. We know that burnout has been associated with the nursing profession for over 40 years. The original work was within the area of nursing and midwifery. Most of the early work and research was drawn from cohorts of nurses and midwives. It's now expanded beyond that to encompass anyone that cares for or interacts with human beings. So there's always a stress attached to that. A particular feature of nurse and midwifery is that we work as emotional labourers. So a lot of our job is in the emotional domain in terms of the caring for individuals, particularly at times of huge distress. And we often see things that other people never see in a lifetime. And we can see those on a routine basis. But there is an expectation that nurses and midwives will just be able to cope with what they experience. But the reality is often there's surface acting to say that we're coping, while there's actually issues are mounting up underneath the surface emotionally. So it can lead to compassion, fatigue, and also moral distress, particularly when there are challenges around the care that we can give. And COVID-19 presented many of those challenges. So this survey, this is the second one, as I mentioned, was carried out between April and July 2021. This was a cross-sectional online survey of nurses and midwives in Ireland. So it was advertised on social media, on our websites, through the World of Irish Nursing, and so on. We captured information on demographics, so we could get a handle on sort of who was responding, and we measured a number of different components which we thought were important. I'm going to be reporting on the COVID specific questions this afternoon, but we also measured impact of event scale, which is a proxy for post-traumatic stress disorder, also burnout assessment, and professional quality of life, and they'll be reported separately. But I'm just going to focus on those COVID specific questions within the time frame. We had a great response. We had almost 2,000 nurse and midwives responding, and when we compare it with other surveys, we think this is quite a high response rate. It compares well with the 2020 survey, which was higher. It was 2,642, but still almost 2,000 is a good response for any survey. So hopefully it will be representative at least of the people obviously that have responded, but also gives us a snapshot and picture of nurses and midwives. Apologies, I'm not sure why it keeps on skipping back and forth. So as we would expect, the majority of respondents were female, and registrations, and remember the registrations can be multiple, and that's why all of the percentages don't add up to 100. Majority were RGNs, 16% midwives. We can see representation across the other sections of the register, children's nurses, IDE, public health nurses, and so on. The predominant area of response, but again covered most areas, was med-surgical, care of the older person, as well as community, midwifery, and so on, as well as intensive care, around about 5%, and also the ED departments, 5%. And we might expect those to be lower anyway, because they are a sort of low representation within the workforce as it is. So it's probably representative of the number in those sectors. So we also asked the question, Did the respondent care for patients with COVID-19, or were they currently caring for patients with COVID-19? And 74% said that they were. This was an increase from 2020, and we might expect that because the longer period of time increases the likelihood of exposure to the need to care for somebody with COVID-19. So it was an issue for the overwhelming majority of respondents, and even those that didn't directly care for patients with COVID-19 were still under the huge pressure of trying to deal with managing infection control and also the processes and requirements related to COVID-19. So this is just to confirm in terms that you care for patients with COVID-19, and just say that it is a third of respondents in the 2021 survey. So it's just to underline that it is generally people that have cared for people with COVID-19 that have responded. Did the patients you subsequently cared for, did they die from COVID-19? And we can see 2021, 62% reported that they had. So again, the distress of caring for patients, particularly with this type of infection, again, can take its toll on individuals, particularly in sort of unusual and unnatural situations where people are being cared for with infection control measures and also in PPE as well. So we asked the respondents, did they care for or did they contract COVID-19 themselves? This was a lower percentage, but we can see this has increased. Again, we might expect that following last year, where it was more around about 12%, but we can see edging towards nearly a quarter of respondents did contract COVID-19. So again, an issue that affects healthcare workers on the front line, their risk of contracting the infection. Now, probably the key question that we asked in terms of our survey is, do you believe that your experience of COVID-19 has had a negative psychological impact upon you? So this is the primary question. So this is a self-reported response. So this is how the individual feels. We haven't set any parameters around this, but we have measured PTSD later on in the survey, and also burnout and quality of life. And what's interesting here is when we compare with 2020, we may have expected, as the virus has sort of dropped off towards the late end of 2021, that there might be less reporting of the psychological impact. But in reality, what we're seeing is almost identical to the figures for 2020, if not slightly more. So what this message clearly sends out is that nurses are suffering from the psychological impact. This is not short-term, this is not short-lived, and this is still a real issue for nurses and midwives. So we asked a slightly different question as well, and the slightly different question was, do you feel that that COVID-19 has had a negative psychological impact on your nursing colleagues? So we can see those sort of high figures for personal reporting, 85%, but this jumps up to 96% when we ask them about their colleagues. So this is quite a significant number. It's sort of very close to 100%. So we again underline that the psychological impact is a real and present issue for nurses and midwives that needs to be monitored and also supports put in place. So just some information from the 2020 survey. We asked a number of questions. When off duty, during the COVID pandemic, did you experience any of the following? And we can see at the top, mental exhaustion is very high. That's the one that sort of is reported, 81%. Mental exhaustion is the key characteristic of burnout. So that underlies probably most of the burnout literature. So when we look at other factors, trouble concentrating, difficulty focusing, forgetfulness, we can see a third of respondents have reported those cognitive issues. Okay, that's a cognitive response related to stress and burnout. So when we look at the 21 survey, and that the other way around, so we can see mental exhaustion, 90%. So that's really high still. So that's gone up. Nurses feeling mentally exhausted, and again, underlying the key characteristic of burnout. And the other measures, trouble concentrating, focusing, and forgetfulness, we can see that those figures have gone up close to nearly 50%. So there's an increase in those cognitive symptoms related to stress in the workplace. Now, these are quite startling findings. This is, has your experience of working during the COVID-19 pandemic caused you to consider leaving the profession? Now, we were surprised last year when we looked at these figures, and we found that 61% reported yes. This year, that has gone up to 68%. That is a warning message that needs to be sent out to policymakers to indicate that, that nurses are under pressure and they are questioning their professional role in response to staying in the profession. Now, just to look at something more detailed, because just because you're considering leaving the profession doesn't mean you will. So when we asked, do you intend to leave the nurse and midwifery profession in the next 12 months, we found, again, this is probably even more surprising, is that, or perhaps not surprising, but shocking really, that in the group likely or very likely, a quarter of respondents indicated that they are likely or very likely to leave the profession in the next 12 months. A clear warning sign, again, to policy makers. So that's again one of the most startling findings. Just the same relationship to those figures, they're very similar to those reported in the UK recently at the RCN Research Conference. And I'm just going to come to the end. I just want to mention 2 or 3 things. One of them is around stress and burnout. So burnout is closely related to workplace stress. And remember, with burnout, and the reason it's burnout is because the individual has to have burned brightly beforehand and expended all of that energy. So these are often the brightest, the most committed individuals that expend everything and give everything until they're burned out and have no more to give. Also to say that stress, burnout are based upon motivation. So they're embedded within motivational theories and relate to emotional and psychological experiences. The opposite is often referred to as work engagement. So this is how you engage individuals. And also remember that crossover and spillover are important factors. So crossover is where you have individuals that are stressed within a department or a ward. That has a contagious effect. So if somebody is burnt out, it's likely to spread over to other people. And likewise, individuals that are stressed or burnt out will transfer over into their home setting, and vice versa as well. The two of them, the 2 aspects do work together, and we can't use the idea that is often cited that work and home life are separate, because that's not a reality in terms of an individual's life experience. And probably the key message, just to highlight, is that there are things individually that a nurse or a midwife can do to improve their coping mechanisms in terms of trying to be able to cope with the demands of stress. You see that in the literature, and you see things such as resilience programs, stress management programs, and they have a place. But we have to remember, in an environment where there is increasing demands and there is a reduction of resources, that is the recipe for burnout. So as we see increasing demands, where resources are not available to cope with those demands, we should expect stress and we should expect burnout, and we should expect retention issues and people leaving the profession. So those demands need to be dealt with, yes, at an individual level, but more so at an organizational and system-wide level, not just left to the individual. And just my final slide is in terms of my concluding comments. We need to recognize the psychological impact of COVID-19. It is ongoing, and these results demonstrate that. This is in addition to the stress that nurses usually feel and midwives usually feel. It is vital that we monitor, both in the short term and the long term, the impact, because we know that in this study, burnout is reported high. That's seen in terms of exhaustion. Action must be taken to balance the demands on nurse and midwives to ensure adequate resources are employed to support individuals and to support work practices. The key intervention that needs to be fully supported and implemented is the safe staffing and skill mix framework. It's not been fully implemented to date in phase 1 and phase 2, but only just moving into phase 3 in the residential care setting. But we need to fully implement that framework to try to alleviate the demands upon nursing. And my final comment is to say that the values of nursing in Ireland are compassion, care and commitment. That doesn't just refer to patients, women, users of the service that we care for, but also relates to nurse and midwives. We must care for each other. We must care for our colleagues in a compassionate, caring way to show our commitment to them. And that's it, Fiona.
Thank you very much, Steve. I have a question for you. What will happen with these results now? We have the 2 lots of results, haven't we?
Yeah, so what we're going to be doing is we'll be publishing in the November World of Irish Nursing. So that's where the results will be published. And we're also going to produce a report with the 2 sets of reports, with the 2 sets of results from the 2 years. And then we'll look to get them published in a peer-reviewed journal. But probably the most important thing beyond disseminating the information, which is vital, is to promote the findings. So we're hoping over the next 2 or 3 weeks to be raising the profile as part of the demands around recognising the contribution of nurses and midwives during the pandemic, and also to use it to put pressure upon the system around fully implementing the safe staffing framework. So anything that we're doing at the moment, we do refer to these results, particularly in discussions with the department and also with the HSE as well.
And Steve, have you? It's great that we've the safe staffing skill piece and the compassion and the commitment to the HSE values for ourselves as well. But is there anything else that managers can be doing to? I suppose we're very overstretched. And even I know in my own role, there's health and well-being, but it's another thing you take on. And yet, you know, you're saying, gosh, there's just not enough time in the day for all of this. But can you give us some tips or?
Yeah, and that places demands on managers as well, remember. So those demands, as staff are feeling the demands and the pressure, those pressures are being crossed over to managers as well. And there's only so much that you can actually do. But what I would say is that the key one is around safe staffing and being able to advocate and push to ensure safe staffing, because ultimately we can cope in a short term where there's an issue appears, but over the long term, that's not sustainable. So managers have a role in terms of ensuring and supporting its implementation, and also in terms of advocating for safe staffing. At a more personal level, I think that it's about being able to recognise early on those symptoms related to the phases of burnout, around people putting too much in to their work, neglecting themselves, then started seeing those behavioural changes in the individual. So the earlier we can pick that up, the earlier we can intervene. We can provide support through occupational health, possibly through the work and health wellbeing unit in the HSE as well. So I think that is important. So as a manager, being fully aware of what the symptoms and what to look out for in terms of burnout, and also what resources are available within the organisation, within the HSE, because there are great resources available in the HSE, and also in the INMO as well, through our psychological support and also our counselling services as well.
Great, that's lovely, Steve. Thank you very much for that.